Doctor, give me the best sleeping tablets that can help with my sleep. You see, that is a question that I get asked a lot of the time, like what is the best medication that can help with sleep? But honestly, there is no such thing as the best medication for sleep because it depends on what's best for you as an individual. There's so many factors that I have to consider when it comes to medication. For example, I have to think about the age of the person. I mean, if you're a child, you can forget about having any medications. If you're elderly, you might be on other medications that might interact with another medication that would give you for sleep. So I have to consider that as well. Also, other factors would be size matters. You know, if you're a big person compared to a small person, you might need a higher dose of the medication in terms of your body metabolism than a slim person would do, for instance. Also, it depends on what kind of sleeping tablet do you want, because there are some tablets that makes you woozy when you wake up in the mornings, or they give you that hangover effect. And there's some tablets that might knock you out. So for example, if you've got kids, you might not want a sleeping tablet that's going to knock you out. So these are some of the factors that we have to consider when we give sleeping medications. So let's talk about the different sleeping tablets that can help. So number one on my list will be a medication called Diazepam. Now, Diazepam is a brilliant medication for sleep. It helps with anxiety as well. It has a calming effect, and we usually give it as a 5 milligram dose to help with sleep. It usually works within 30 minutes of taking it. However, the problem with Diazepam is that if you take it, you might have a very good sleep where basically if your baby is crying, you might be knocked out and you might not hear your baby crying. So just be aware of that fact that though Diazepam works very well for sleep, you might not be that alert if something was to happen in the house. If there was a fire in the house or baby crying or burglary going on, just be aware that Diazepam has that kind of effect to knock you out. In some cases, the reason why we're very reluctant to give Diazepam is simply because it has an addictive effect, because it works too well for sleep. And we usually give Diazepam as a short-term medication. So we normally say, look, do not take Diazepam for more than 2 weeks, for instance, or some doctors might be a bit more stingy and give it to you for just a week. We have people who have been so addicted to Diazepam that they have to rely on Diazepam for sleep. Like they'll say, doctor, I need my Diazepam today. I cannot sleep tonight if I don't have my Diazepam. And that is a problem. We've had people who've been on Diazepam for over 20 years because they cannot sleep without taking Diazepam for that night. And it's becoming a major problem, you know, in our medical field where we're trying to get these patients off Diazepam, but they're too reliant on it. And it gets to the point as well where basically a 5 milligram dose of Diazepam no longer works for you, and that's what we call tolerance, where your body is so used to taking the Diazepam that now you need a higher dose of Diazepam to help with sleep. So we do find some people taking 10 milligrams or even 20 milligrams of Diazepam to help them get to sleep. So Diazepam, good medication for sleep, however, has to be taken on a short-term basis. Another medication that can help with sleep is called Zopiclone. So Zopiclone usually comes in a 3.75 milligram or 7.5 milligram tablet. So a bigger person, for example, might find that a 7.5 milligram tablet works better than a 3.75, but we usually advise try the 3.75 milligram tablet first. If that doesn't work, then you can switch to the 7.5 milligram tablet. Zopiclone is good for sleep. Doesn't have the same addictiveness as Diazepam, but it is also addictive medication as well, and a lot of people find that they tend to be reliant on Zopiclone for sleep. It does have a little bit of hangover effect in the mornings where you might feel a bit groggy when you wake up in the mornings, and that's similar to Diazepam as well. However, in terms of sleeping tablets, whether it's Diazepam or Zopiclone, we do tend to advise maybe try not to take it every night to help you to stop becoming so dependent on the sleeping tablet. So maybe try taking it every other night, i.e. on an alternate night. So for example, if you took it on a Monday, skip the Tuesday, take it on a Wednesday, skip the Thursday, take it on a Friday. So at least that way you have a good night's sleep every other day. So Zopiclone can be taken as a 3.75 or 7.5 milligram tablet, good for sleep. Again, we normally advise not to take it for more than 2 weeks. However, if you take it every other day, as I suggested, you can actually stretch your Zopiclone to a month. I usually will not give more than 14 tablets of Zopiclone at a time, simply because, again, it depends on the person. There are some people who are suicidal and they use sleeping tablets, you know, as a way of, you know, self-harm, or as a way of saying, look, I want to go to sleep and never wake up again. So in terms of sleeping tablets, we try and limit the amount of sleeping tablets that we give to patients. Another cousin of Zopiclone is called Zolpidem. Zolpidem is similar class to Zopiclone, and some people find Zopiclone does not help with sleep, so we can try them on Zolpidem, or they might have side effects to Zopiclone. So usually we give this group of people Zolpidem, but works in the same way as Zopiclone. So now we've talked about Diazepam, Zopiclone, Zolpidem. Another medication to consider would be your sedative antihistamines such as Phenergan. So Phenergan can be bought over the counter. Sometimes I do give it on prescription. I think over the counter has a lower dose, which might be a 25 milligram dose. In terms of a 25 milligram tablet, you can try taking one at night, or you can take 2 tablets of the 25 milligrams, which would be 50 milligrams. Now, Phenergan is good for sleep. However, it's not as effective as Zopiclone or Zolpidem. However, it does not have the same addictive side effects or the same tolerance side effects as Zopiclone or Diazepam, for instance. With Phenergan, you have to take it at least an hour or 2 before you go to sleep, unlike Diazepam or Zopiclone, which you might have to take 30 minutes before bedtime. It does take a while to work, and you might not see the same effect on that same night. However, if you start taking the Phenergan, maybe by the 5th or 4th night, it might start to kick in terms of sleep. Again, I don't tend to worry too much about giving you, like 28 tablets of Phenergan or like Zopiclone, simply because it does not have the same addictive side effects as Zopiclone. However, like any other sleeping tablets, we normally advise, do not rely on sleeping tablets. Again, try and take it every other night, just to make sure that you don't become dependent on these medications. So there is Phenergan, there's Hydroxyzine. Again, that's the 25 milligram tablet. It's a sedative antihistamine as well, and that's similar to Phenergan in terms of the way it acts. Another sleeping tablet to consider will be Amitriptyline. Amitriptyline is quite good, especially in the elderly, and it is a low dose tablet. You can take it as a 10 milligram or 25 milligram tablet, or you can take 2 tablets of 10 milligrams, and that's assuming that the 10 milligram tablet does not help with sleep. So you take it at night time, usually around 7 o'clock in the evening. Again, it might take an hour or 2 for the amitriptyline to kick in. Amitriptyline, I tend to look at it more as a multifunctional drug. So it helps with anxiety, depression, migraines, neuropathic pain due to conditions like diabetes, for example. So it does help with lots of conditions. However, for sleep, we usually advise to take it as either a 10, 20 or 25 milligram dose. Side effects of amitriptyline: it can cause constipation, can cause blurry vision, can cause dry mouth. And again, similar to your Zopiclones or your Diazepams, you might feel a bit groggy when you wake up in the mornings. Another medication that I would consider in terms of sleep will be Mirtazapine. Now, Mirtazapine is brilliant if you have other symptoms such as low mood or anxiety, because Mirtazapine, you can actually titrate up to that dose. However, Mirtazapine has to be taken at night. It is an antidepressant. The dose at which Mirtazapine works best is either a 7.5 milligram or a 50 milligram dose. If you start increasing the dose to 30 or 45 milligrams, that's when it starts to work for anxiety and depression, and it works less with sleep at the 30 or 45 milligram dose. So for example, if I was to give you a Mirtazapine for sleep and you have other symptoms such as low mood or depression, I would advise you take it at a 7.5 or 50 milligram dose. Which means if you have a 50 milligram tablet, you can break it in half to give you a 7.5 milligram tablet to take every night, and that would help with your sleep. I mean, there are various other medications, but they're not usually given for sleep, where you can say their side effect is to help you sleep, such as your pregabalines, your gabapentins, cocodamol as well, which is usually given for pain. And these are all pain medications that can also help with sleep. In terms of over-the-counter medications, I'm not really too familiar with that, but I know you've got medications like Nytol or Kalms, which contains valerian extract or herbs, which some people find helps with sleep. But do not also forget that lifestyle is very important. You have to think, what is causing my sleep? Is it stress at work? Is it stress at home? These are things that you have to address that would help with sleep, and you cannot just rely on taking medications for sleep, because medications are meant to be short term. So in terms of lifestyle, you might want to think about, how do I tackle the stress? Do I need counseling? Do I need some time away from work? You also have to consider your diet. Am I eating late at night? Heavy meals, this can affect your sleep. Some people find drinking, a glass of red wine helps with sleep as well. However, drinking too much alcohol can also have a counteractive effect in terms of your sleep. Exercise is very good for sleep. Exercise, releases endorphins, makes you feel good. It also makes you feel tired, and that helps with sleep. You should also consider kind of like relaxing music, mood music. Some people listen to like waves or oceans, that noise kind of helps with sleep. Some people find listening to classical music helps with sleep. Sometimes, everyone has sleep problems from time to time. No one's immune from having sleep problems. I get sleep problems myself. I find that listening to the Bible, helps just calm my soul and my spirit down. That helps with sleep. listen to calming music. For me, that helps with sleep as well. So everyone has their own way, of dealing with their own sleeping problems. So if you ask me, okay, doctor, if I was to choose out of all these medications for sleep, what medication would you give me? I'll give you Zopiclone, because I find that Zopiclone has the less side effects, to help with sleep. It is short-term medication. I'll give you 14 tablets to last 2 weeks to a month, and then I'll bring you back to review. But if I find that you're someone who's maybe addicted to tablets, I might give you something like Promethazine or Phenergan, which I find is sedative antihistamine. Might not knock you out, but again, it's quite good for sleep as well. If you're someone that takes several medications, you're on like 5 or 6 different medications, I think, Promethazine is another good option for sleep. Amitriptyline, can interact with your other medications, can cause blurry vision, dry mouth, all these other side effects. If I find that you're someone who's depressed or anxious, I might give you Mirtazapine at a 15 milligram or 7.5 milligrams, which is half a tablet of the Mirtazapine, to help with sleep. So in terms of best medication, it really depends on, who you are, what you're taking, your age, your size, gender, several other factors. So I hope you like this video, and please feel free to subscribe to my channel.